Hello, I'm Dr. Nina Kramer.
And I'm Dr. Dennis Davis. Dr. Kramer, what is a periodontist and why would somebody want to see a periodontist?
A periodontist is the expert in treating gum disease. So they are dentists, but they've had years of additional training in management and treatment of gum disease. So in our residency, we study the technologies available to treat gum disease and also monitor how well these treatments work. And we use the latest and greatest science and technology to make sure that we're managing periodontitis as it should be. So a lot of times patients don't have their periodontal disease diagnosed properly, and it goes on for years and causes so much destruction that the patient actually ends up losing their teeth. And this causes them to have to replace their teeth with dentures or expensive dental implant treatments. And if they would have just been managed properly when their disease was in a lesser extent, then they could have saved a lot of their teeth. So it's a little bit different in dentistry than in medicine, because in the medical community, if you have a complex or severe disease, your general practitioner will send you to a specialist, like a cardiologist if you have a heart condition. But in dentistry, it's not common for that to be done. The general dentist, your family dentist, will just take care of you to the point that the disease is so complex that they can no longer manage it in their office. And this leads to a lot of tooth loss, actually, that could have been avoided if the patient would have just been referred to the specialist early on. And the periodontist is that specialist to treat the gum disease. So if you've been told that you have gum disease and you need a deep cleaning by your family dentist, you should ask questions. Thank you for watching our short video today. If you have any further questions, please contact our office at 352-259-6799.
Thanks again. Appreciate it.